if you have swollen prostate, if you have issues, maybe you should try to raise it. It really depends on what's going on. I can't really just give, this for that, this for that. We know that excess iodine comes out in the urine. So somebody who has a fibroid in the breast, I would say they would need more than 2 drops. Somebody who has cysts in their ovaries, I would say they need more drops. So the 2 drops is what the Jorge Fletchas and Guy Abraham in the 80s figured out with their Hakala lab would bring you, once you were sufficient in iodine in your system, all the cells were saturated, the 2 drops a day would top you up, as the British like to say. That's all you needed to put in to make sure that you had a constant supply, adequate supply. It's more important for women, definitely during adolescence, because women build more sexual characteristics. So women build physically more stuff. They build breasts, they build a uterus, it increases, the ovaries get bigger. All these tissues need iodine. So men obviously need iodine during adolescence too. The testes and the scrotum are growing bigger, but they don't need as much. They will also suffer if they're around goitrogenic substances, but not as much. So yes, women, an adolescent, and in fact, Marine's studies in Akron, Ohio, he was preventing goiters in adolescent girls in the 20s. He didn't even bother with the boys. He didn't check them out because they didn't have a history of getting goiter. If you have a breast cyst, definitely put it on your breast, paint your breast. If you have a skin lesion, a mole, put it on there. You can put it on your skin that way. It's amazing at healing wounds. So Dr. David Dare even put out a paper with showing how the skin healed faster, a laceration and a wound healed faster with iodine, and he would put saran wrap on it. My husband and I, my kids take it in a glass of water. We use gelatin caps. A glass of water, a little bit of water, because it's going to evaporate some. So it's not enough. You're not going to saturate your cells by painting yourself with it. It's a decent test to see how much you need, because some people, it'll last for 12 hours, and some people it'll be gone in a half an hour. That means they sucked it in, right? But for me, it's not adequate as a dosing mechanism to put it on your skin. No, it only does good. All mucus-bearing tissue is really rich in iodine. So mucus-bearing tissue being in the gut, the intestinal, the villi the villi are covered with the mucus, your nasal passages, the vaginal canal, everywhere where there's mucus has a ton of iodine.